Bismillahirrahmanirrahim. Which one of the following groups has the highest risk of developing an iron deficiency? Which one of the following groups has the highest risk of developing an iron deficiency anemia? Breastfed babies, toddlers, vegetarians, adult indigenous males, postmenopausal females. Breastfed babies, toddlers, vegetarians, adult indigenous males, postmenopausal females. The prevalence of iron deficiency is highest in toddlers after weaning. Children 1 to 2 years of age, followed by adolescents, and then women of childbearing age. So, option B is correct. Breastfeeding or use of iron fortified formulas are important safeguard against iron deficiency in children. Vegetarians usually get adequate iron from green leafy vegetables and other plant source. Iron absorption from plant source is enhanced by vitamin C. Adult indigenous males are at risk of anemia of chronic disease, particularly renal impairment, but not due to iron deficiency. Females who are no longer menstruating are less likely to have iron deficiency than premenopausal or multiparous women. So here toddler groups will have a iron deficiency which is the highest. So option B, toddlers, which is correct. Our next question, a 44-year-old man present with a 2-day history of pain in the left side of the scrotum. He has no other symptoms and is normally in good health. On examination, he has a temperature of 38.6. The left hemiscrotum is reddened and tender to touch. The testes and cord appear enlarged and thickened. Which one of the following is the most likely diagnosis? The patient is having a fever and pain in the left side of the scrotum. So fever and pain, scrotal pain, most likely is infective. Option A is obstructed inguinal hernia, varicocele, torion of the testes, infected hydrocele, epididymoarthritis. Acute testicular pain can be a real surgical emergency with an outcome often depending on the rapidity with which the diagnosis can be made and the underlying problem corrected. The most important underlying problem to be considered is testicular torion, and the diagnosis should be made on clinical grounds. The main point to consider is the age of the patient. This patient is in the wrong age group of for torion, and a much more likely explanation for this 44-year-old man's scrotal pain is infection, and which is epididymoarthritis. So option E is the correct option, epididymoarthritis. The length of the history also favors infection rather than ischemia. The obstructed inguinoscrotal hernia could produce a somewhat similar picture, but it's unlikely such a patient would have a fever and the scrotal swelling is secondary to and in continuity with an inguinal swelling. An infected hydrocele is an extremely uncommon event, though it is infected, but it's an extremely uncommon event and usually only occurs after instrumentation by needling and aspiration. Means if infected hydrocele when we are suspecting, there must be some procedures which should be mentioned in the history, either aspiration or instrumentation by needling. So then we will think about the infected hydrocele. A patient with a varicocele would usually present with a swelling or discomfort in the scrotum of weeks or months duration, and the swelling is soft and compressible. So here epididymoarthritis is the correct answer. A 25-year old nulliparous woman present with a 2-week history of painless swelling in her right breast. On examination, there is a discrete, firm mobile mass in the right upper quadrant, 2 cm in diameter. Which one of the following most likely diagnosis? 2-week history of painless swelling in the right breast. 25 years young. Carcinoma of the breast, fibroadenoma, intraductal papilloma, a prominent area of fibroadenosis, an area of traumatic fat necrosis. So this is the typical history, a typical clinical picture of fibroadenoma. So B, option B is correct. None of the other diagnosis is as likely in this young patient. Fibroadenoma are a focal breast lesion seen commonly in young patients in their teens, 20s and 30s, and are the most common condition in these age groups, giving a palpable lump. Consensus view is that fibroadenoma represent areas of focal growth anomaly and are not related to and do not predispose to breast carcinoma. They can occur at all ages and are frequently picked up as symptomless and impalpable. Image detected focal parenchymal lesion in the older woman on breast screening, often with characteristics associated benign macroscopic calcification. However, in an instance such as this, where the problem is of a young patient presenting with a palpable lump, differentiation from a breast cancer is essential even though the clinical features are typical of fibroadenomas. Required investigation are imaging by ultrasound, not mammography in this young patient, in whom mammography is much less accurate than in older patients because of the density of the parenchyma and cytologic fine needle aspiration cytology and or histological percutaneous core biopsy. Confirmation of the diagnosis is essential to give a definite diagnosis and to be able to reassure her. In the presence of a triple test diagnostic of a benign cause of the lump, clinical findings, imaging and cytology or histology are all negative for cancer, the patient can be confidently reassured the lump is benign and periodic review only is appropriate. Means we have to go with the ultrasound, FNSC and biopsy. So 3 tests we have to do. Alternative, the lump can be removed if the patient is excessively concerned and wishes to be rid of the worry of continuing follow-up or follow-up is difficult for other reasons. Remaining carcinoma of the breast can present in a young patient such as this can mimic the clinical feature of a benign lesion such as fibroadenoma, hence the necessary for definitive diagnosis by biopsy or cytology even when clinical features are otherwise typical or benign condition. Intraductal papilloma usually present with bleeding from a focal nipple duct and lesion are usually small, impalpable. Treatment is usually surgical, microadenectomy, microductomy via periareolar incision. Fibroadenosis can present either as diffuse lobularity or localized dominant and discrete lump, which would also require biopsy diagnosis, as would a focal lump due to a fat necrosis.